My name is Ernestine Tucker. I'm 36 years old. I work for Roche Pharmaceutical. And my son's name is Taji. He's 19 months old. I'm married. I have my husband's name is Robbie Tucker, and he's a great partner to have around. I knew I had fibroids because when I lived in New York, I got diagnosed with fibroids, but it was a very small size. It wasn't a big fibroid. So when I finally got married and we started to start a family, my GYN told me that my fibroids was not a problem. And we tried for a while, for almost a year, and there was no pregnancy and nothing really happened. So when my friend told me about Dr. Peter, I was a little hesitant because I tried, and I went to different doctors. They didn't really help me out, but I figured, you know what, I had nothing to lose, I can try it anyway. I had an appointment with Dr. Peter. I went to see him, and he made me very comfortable. He pretty much had a model in his office, and he pretty much explained to me what the fibroid looks like and what it can be in the body. So he pretty much ordered a CAT scan. So I had 3 big grapefruit size fibroid in the uterus, which was pretty much preventing me from getting pregnant. So obviously, if I did conceive and getting pregnant, the chance of the baby surviving was not high. It was pretty much low. So the procedure was the best option at this time, and I knew that the fibroids need to come out. I know from the traditional fibroid surgery, it's pretty much a big cut. And telling me that he's making little nicks in the abdominal for the surgery, that kind of intrigued me, because compared to a big incision and a small nick, I think I'd rather take a small nick than having a big open cut in my abdominal. So with the Vinci procedure, it was an outpatient procedure, meaning I'm in and out the same day. And that also intrigued me, because instead of staying in the hospital overnight or being for a few days, I knew that I can go home and rest in my own bed. And I went to the hospital. I felt very comfortable because of his level of comfort, and I pretty much trusted him because he was there from the beginning and to the end. So I really felt comfortable being there and having him as my surgeon to do the procedure. He had a picture in his office of the robotic procedure, of the instrument, and I looked at it. It looked kind of weird, but he actually got the job done. When I woke up in the recovery room, I had some kind of pain, but it was not severe. It was bearable, and I was able to move around after at least about 2 hours or so of being in the hospital in the recovery room. And I think they gave me Percocet, but I'm not big on medication, so I did not take a lot of that. But pretty much I was able to walk from the car to the house when I got home. So it was okay. The pain was bearable, and after being home for a week or so, I was able to walk a little faster than I did when I first got home. I sit a lot. I have a lot of teleconferences also, so I don't move around a lot. But since I had the surgery, I knew I had to move around just to get the circulation going. But I didn't lift anything heavy at all. But it was pretty much sitting at the desk and just doing my work. So it was okay to go back to work after a few weeks. I mean, after I probably went back to work in 2 weeks if I wanted to. But I needed that extra time just to make sure I was okay. I had a friend that had a hysterectomy. She had a total hysterectomy because her fibroids were so bad that she couldn't even go to work when she had a period. So she opted to take the hysterectomy. Plus, she had 2 kids already. It took her 2 months to recover from that procedure, unlike the Vinci procedure, which only took me about 3 weeks for me to recover. I was really surprised when I was pregnant. I mean, I took the pregnancy test, and I was like, wow, this actually helped. It was smooth. I had no pain. I had no problem with the pregnancy at all. So it was really amazing. After 3 months of the surgery, I was able to conceive. That just kind of shows you that, yes, the fibroid was the cause of me not getting pregnant. So the Da Vinci procedure actually did miracles for me. So that's why I can actually say, and my son, 19 months now, he's really a joy because he's really blessed my life a lot. And if it wasn't for Dr. Peter and the procedure, I don't think I would be holding him right now.